to introduce you to our awesome speaker, Stephanie Craig Rushing. She serves as the project director for the Garrett Lee Smith Tribal Grant, and she will talk about We Are Native, which is one of their major communication initiatives.
I am Stephanie, and I work at the Northwest Portland Area Indian Health Board, and our organization serves the 43 tribes in Oregon, Washington, and Idaho. And within our region, we were looking for avenues to reach teens and young adults with health promotion messages, and we built out a multimedia website for teens and young adults to provide kind of holistic, comprehensive health information to young people. So that's the primary channel that we use to promote mental health and suicide prevention messages. We use the social marketing process that is provided in the Kansas Community Toolbox. So this is a great online resource for folks who want help walking through the steps of planning a social marketing campaign. We have used that process for a variety of different health campaigns over the years and kind of tweaked it to fit the regional planning that we do with our 43 tribes. So our first process is always to really focus in on our campaign goals and objectives, looking at our epi data to select our audience and risk and protective factors that we think we might be able to focus in on through the campaign. And then the second phase of our campaign process is to really test a series of messages and slogans and the tone of the campaign with our audience. So we have done a wide variety of things to gather this information over the years. We do surveys on the different slogans that we're looking at, the tones of the campaigns. We've done key informant interviews and focus groups in a more sort of formal process going through the institutional review board. But most often we do informal sort of information gathering. We go to youth conferences throughout the summer camps. We'll test different layers of the campaign with our social networks within the tribe as well too. Often we'll work with the creative folks to come up with a number of slogans and then test them with our audience and have them kind of refine the direction that we go, and always they make improvements to what we and the developers were coming in with. We also do a survey of teens' technology use every couple of years, and this helps us narrow in on the communication channels we're going to focus on to reach young people. Of course, we know this stuff changes really frequently, so we also try to just keep abreast of what young people are saying and seeing. So we also have 100 youth ambassadors that work on behalf of We Are Native to support the program and outreach in their communities, so they will also kind of give us a sense of what channels we should be on. So I'll share some examples of the messages that we've put out, always linking folks back to the We Are Native website for more information. We have an Ask Auntie Q&A service that teens can post in their questions. They're usually anonymous, and folks can get either a specific response around mental health topics, or we'll post a response on Fridays. We do boot camps around social marketing with teens and young adults. So every summer we do 5 workshops with young people that generate their own campaigns where they create their own messaging around suicide prevention and kind of put together their own sort of messaging plan, how they want to extend the reach of the campaign using their own social networks, which is really fun to see the young people get involved. We also use a text messaging service to reach teens and young adults, and we have a weekly text message tip that goes out to folks. We use that channel to reach young people and link them back to the resources that are on the website. We track the social media analytics to monitor the reach of our campaign materials, and about 20% of the traffic to the We Are Native website is around mental health topics. So we post lived experience videos, and we work very closely with the young people who are contributing, sharing their stories to help them frame their message of going through a suicidal period and how they got through that, and what people helped them through that period. And we do boost messages on social media. So that is something we use to increase the reach of our campaign messages. So we try to make sure the message is focusing on actionable and help-seeking behavior.